Whether you're just turning 65 or perhaps you worked a couple extra years beyond and you're calling it quits, I understand there's a lot of different Medicare options out there. You've got Medicare supplement plans, you've got Medicare Advantage plans, you've got Part D drug plans, and every little option in between to try and learn about. And if you're turning 65, of course, your mailbox is full every day, full of different insurance information from all the companies, probably agents writing you saying that they want to sign you up. I understand it's pretty overwhelming. I'm going to talk to you today specifically about Medicare supplement plans and even more specifically about a Cigna Medicare supplement. Cigna is a top company in the industry, one you definitely want to consider. They offer a whole variety of different insurance plans, such as life insurance and disability insurance, things like that, which is good. And they have a variety of different companies within the company. So their family of company has names like American Retirement, Cigna Health and Life, Loyal American. It just depends on what state you're in. But I'll break down exactly what the different Medicare supplement plans from Cigna cover, and then it will give you a good idea of which plan is best for you. So like every other company out there that offers Medicare supplement insurance, Cigna offers the most popular plans, of course. Now those plans are Medicare Plan G, Plan N, and Plan F if you still got it. Anybody new to Medicare cannot enroll in a Plan F. They took that away in 2020. Medicare took it away. And they said, well, if you still have a Plan F, you can keep it, but nobody new can get on that. That's okay, though. Don't worry. You didn't miss out because Plan F is too expensive anyway. And Cigna Medicare Supplement Plan G will absolutely be their most popular plan this year. And for good reason. The coverage on Plan G is fantastic. I'll get right into it and explain what Plan G actually covers. Now, keep in mind one thing. I'm talking about the Cigna Medicare supplement on this video. We represent all of the different companies as an independent agent here at Medisupps.com. The reason we do that is because every company has exact same benefits within each plan letter. That means a Cigna Medicare Supplement Plan G is the same as a Mutual of Omaha Medicare Supplement Plan G, as the same as an Aetna Plan G. It's all identical coverage. However, each company charges entirely different premiums, sometimes substantially higher or lower, and we shop those rates for you. Now, with Plan G, I mentioned it's going to be the most popular plan, regardless of which company that you end up going with, because there's only one out-of-pocket expense with Plan G, and that is you must pay the annual Part B deductible yourself. Now, in 2020, that deductible is $198. This means the first $198 of your medical bills you pay. After that, Medicare and the Plan G will come in and pay 100% of all your approved expenses for the rest of the year. That is fantastic, and the premiums are relatively low, and Cigna offers a household discount in many different states. Now, that deductible that you pay, that first amount before the insurance companies come in and pay, that is a once per year deductible. It's got nothing to do with the Plan G. It's got nothing to do with Cigna. Medicare puts that out. Part B Medicare covers your doctor's services. And before Part B pays anything, you or the plan has to pay the deductible. And with Plan G, you just pay it yourself. Write the check for the first $198 of your medical bills, or if you're watching this in 2021 and beyond, whatever the amount is that year. And after that, 100% coverage for the rest of the year. Now, another very popular Cigna Medicare supplement is Plan N. And Plan N is a terrific plan. It's pretty similar to Plan G, but it's got a couple other out-of-pocket expenses that you might incur. Now, you get lower premiums on Plan N each month, however, in exchange for those out-of-pocket expenses. Some of those might be an additional copay per doctor's visit. On Plan N, you still pay that Part B deductible like Plan G, and then you might have up to a $20 copay per doctor's visit each time you go for the rest of the year. And on Plan N, also, if you visit the emergency room and you're not admitted, they're going to charge you a $50 copay. It also doesn't cover what's called Part B excess charges, but those are extremely rare, and you probably never see one of those. However, what that means is if the doctors don't take the assigned rates from Medicare, and nearly 100% of them do, about 97% is the last figure I read. If they don't take the assigned rates, you might see a small percentage because they can charge up to 15% extra on the bill. Considering that many doctors accept the assigned rates, and yours probably does too, you can simply ask him or her if they do. It's very rare you'll even see a Part B excess charge. So Plan N from Cigna, fantastic option. Plan N also has lower rate increases each year than Plan G. This is a great plan for people who are healthy or maybe coming off a Medicare Advantage plan and they're used to lower premiums and they just know they need great coverage just in case, but they don't want to pay a higher premium each month. The Medicare Plan N from Cigna is a fantastic choice. Well, the big question is always, how much is a Cigna Medicare supplement, a Plan G or a Plan N? What is this going to cost me, you're asking? Well, because there's so many people watching this video right now, I can't run quotes for you all. These rates are determined by a number of different factors. So you might be 65 and your friend might be 67, and he or she might say, well, I pay this much, go on this plan. Well, it's entirely different for you, especially if you live in different states. So the only way we can tell you what the rates are is, number one, if you visit MediSups.com. Go to the website. I'm one of the few sites that puts the rates up there. I actually show you the rates. A lot of other companies will tell you, enter your information here, and then you go on down through the whole process, and there's nothing there, and then the phone calls start from 10 different agents because they sold your name. We don't sell your information. You'll talk to myself or my top agent, Diana Firth. She's the best in the country, and if you do go to MediSups.com, like I mentioned, you will see the rates. But really, the easiest way is just give us a call. There's no obligation, and you never pay us a dime for our services, but we're here to help. We've got over 10,000 clients in the last 10 years that we've helped with their Medicare supplement insurance, and we're thrilled to talk to you, answer any questions you might have. We know you got a lot on your mind, and again, never any obligation, no pressure ever, and we're just here to help. So give us a call now at 1-888-891-0229. We can discuss a Cigna Medicare supplement plan for you as well as other companies because we are independent brokers. We don't work for them, we work for you. Thanks for watching. We can't wait to talk to you soon.